Hello there, welcome to GCSE Biology. We're still talking about transport in animals. We are just coming from our lesson on the transport on why we should monitor the heart rate. We got to see that when the heart starts beating irregularly, it is a sign of something bad about to happen. Therefore, we need to monitor our heartbeats regularly or our pulses regularly. Now, the thumb is not used in checking the pulse because the thumb also has its own pulse. Therefore, if you use that to check the pulse, you may think that you are detecting pulse, but in actual sense, you may be detecting the pulse of the thumb. Today, we're going on to a disease that affects the heart, the coronary heart disease. So, what is it? Now, deposits of fatty acids are laid down in patches in the lining of large and medium arteries. Now, we know that these arteries are responsible for the carrying of oxygenated blood. These deposits are called the atheromas. The patches get more numerous and extensive with age. So gradually, they are just building up. As you start or as you're giving birth to, they start building up bit by bit. So gradually, the atheromas build up. Now, these patches will form a continuous layer which will reduce the inner diameter of the vessel. So here, naturally, it's supposed to be hollow, but with time, these atheromas will build around or along the walls, reducing the diameter. Now, the surface part of the atheromas sometimes become rough and cause fibrinogen in the plasma to deposit fiber on it. Okay, the fibrinogen in the plasma will deposit fiber on the atheroma, and then a blood clot is formed. So in the beginning, they were just fat, and now fiber will be deposited on it, and then finally a blood clot called a thrombus will form. If the blood clot blocks the coronary artery, which supplies the muscles of the ventricles with blood, it starves the muscles of oxygenated blood and reduce blood supply to the heart. So first of all, we started with the deposits, which are called the atheromas. Then now we see that blood clots are also formed by the deposition of fiber. And then finally, in the early stages of the coronary heart disease, the atheromas may partially block the coronary artery, which will reduce blood supply to the heart. So coronary heart disease is just a blockage in the arteries that will result in a reduction in blood supply to the heart. This can lead to angina, a pain in the chest that occurs during exercise or exertion. So this is in the early stage of heart diseases. You're going to feel a pain in the chest during exercise or exertion. Once you start feeling that, you really need to get some help. So that is briefly how the coronary heart disease comes about.